Strong evidence indicates that aggressiveness or violence is associated with sex hormones like testosterone. Men who have higher levels of testosterone typically have worse tempers. They display more aggression. And if you go into prisons and look at men who are in jail for serious violent crimes, a lot of them, certainly not all, but a lot of them will have higher than normal testosterone levels. By the way, there's some evidence suggesting that even women who are exposed to high levels of testosterone in utero or have abnormally high testosterone levels themselves may be also more prone than the general population of women to various forms of crime and deviance. Some abnormalities in body chemistry appear to be associated with criminality. For example, hypoglycemia, a condition related to blood sugar, is extremely common in male prison populations, especially those incarcerated for serious violent crimes. Now, again, let's be careful. This may not mean what it appears to mean. Maybe the reason that so many male male prisoners, particularly violent criminals in jail, have hypoglycemia is that, well, they lack self-control. They were raised on a crappy diet. They grew up in poverty. There may have been various things that contributed to their blood disorders or the blood sugar abnormalities that may be simply coincidental. Or maybe it's a spurious relationship. The very things that may have pushed them more towards crime may also have made it more likely that they'd suffer from certain kinds of medical conditions like hypoglycemia. Nevertheless, it is still suggestive, and it's always possible that for some reason, somehow, hypoglycemia may contribute to more aggressive, more violent behavior. Now, up to this point, we've talked a lot about inheritable characteristics that may contribute to crime. As long as we're talking about biological factors, let's talk more broadly and look at other evidence that suggests that non-hereditary biological factors may play a role in crime. Here we'll just mention a few. Brain abnormalities, often associated with injuries, may predispose people towards violence. Serial killers, many of whom have highly abnormal brains, are an extreme example. If you look at brain scans of many serial killers, their brains are, well, beaten up. They show all sorts of symptoms of past abuse, past accidents, and other kinds of abnormalities, sometimes lesions and even tumors. Although we have to be careful because not all serial killers have brains that are all beat up, that are extremely abnormal. Nevertheless, a lot of violent criminals, especially our most violent, sadistic criminals like serial killers, appear to show all sorts of brain abnormalities which may contribute to more aberrant, violent, aggressive, and criminal behaviors on their parts. Poor diet appears to be associated with higher risk of delinquency and antisocial behavior among younger kids. Lots of research suggests that. Some studies suggest that improved diet may reduce such risk. The evidence for adult criminals is less clear, however. But some research suggests that deficiencies in certain fatty acids, like omega-3 fatty acids, like the stuff you get in your fish oils, may encourage greater tendencies towards crime and violence. And there's been some research, ongoing research, in the United Kingdom to see whether improving the diet, giving vitamin supplements and fatty acid supplements to people released from jail will actually make them less likely to commit crimes once they get out of jail. We'll just see how that research goes. One final example of a non-hereditary biological cause or possible cause of crime and violence. Research suggests that some environmental contaminants, especially heavy metals like lead, may increase risks of criminality, especially when children are exposed at very young ages. There's various reasons to believe that exposure to lead messes with young kids' brain development, their neurochemistry, and so forth. And long-term heavy exposure beginning at young ages to lead is associated with impaired brain function, mental retardation, and all sorts of behavioral problems in young kids. It also appears to be correlated in a lot of indirect ways with crime rates, and we'll probably mention that a little in class. So I'm going to leave that one dangling. At any rate, I think that finishes up our discussion, our brief discussion on sociobiological or social biological theories of crime. For right now, a lot of these issues are open questions. There is mounting evidence that biological factors, both inheritable and non-inheritable, may contribute, perhaps substantially, to crime and violence. But there's a lot of other possible explanations for crime and violence that do not emphasize biological factors. Those focus much more on social, economic, and psychological factors. And we're going to talk a lot more about those kinds of explanations and theories in class. For right now, thank you very much, and we'll see you in class.